Hi, everybody. My name is Kavi Bhalla. I'm an assistant professor in the Department of Public Health Sciences at the University of Chicago. I'm sorry that due to an unfortunate accident, I had to cancel my trip and I'm unable to be with you in person today. My talk focuses on the importance of building national road safety institutions that can coordinate large scale road safety interventions. I will present a case study of how Argentina got a national road safety agency, and I will draw lessons for other low and middle income countries. Before we talk about Argentina, let me start by showing you this graph, which shows trends in road traffic death rates in high income countries. On the y axis is traffic death rates per 100,000 population, and the x axis is time since the year 1950. Each line represents a country, and these are all rich countries. It is very interesting that prior to 1970, all high-income countries had rising road traffic death rates. But since that time, they have seen steady improvements. In contrast, traffic death rates in most low and middle income countries are either rising or are stable at a high level. Therefore, it is very important for low and middle income countries to understand how high income countries have achieved such long lasting improvements in road safety. These improvements have been happening for almost 5 decades. And especially, it is very important to understand what changed in the 1970s that made it possible for these countries to reverse their rising trend in traffic deaths. The answer to this question is that there was a major shift in how high-income countries began to view road safety in the 1960s. Before then, road safety was viewed mainly as a problem of drivers behaving badly, and the solutions were primarily focused on educating drivers or punishing road users. In the 1960s, a new understanding emerged that traffic safety should be addressed by systematically addressing all risk factors, including improving the design of cars, the design of roadway infrastructure, improving post crash medical care, among others. Many of you are probably familiar with the Haddens matrix approach, which emerged in the US in the 1960s and which prescribes such a systematic approach. Equally importantly, countries during this period established national road safety agencies that had the legislative mandate to coordinate large scale traffic safety programs and the financial resources that are needed to develop and deploy a wide range of interventions. At present, most low and middle income countries have not established such road safety agencies. A notable exception is Argentina, which is the focus of this case. In summary, what happened in Argentina is that in 2008, the president of the country sent a road safety bill to Congress, and the road safety bill was unanimously passed. The bill created a national road safety agency with a mandate to coordinate road safety nationally, and it also gave the agency a sustained funding stream. Immediately after being established, the Argentine government approached the World Bank for a loan that aimed to build the agency's capacity to undertake large coordinated interventions. Clearly, these are important developments. At the very least, they suggest that the government was very serious about addressing road safety. It is important for us to understand how Argentina got to this point, and let us take a look at this closely. The work I'm describing is published in a 2019 publication in the journal Health Systems and Reform, and it's also available as part of the proceedings of this conference. Argentina is a federal country, and an important thing to understand about Argentina is the extent to which decision-making authority is decentralized. Argentina's political history in the last century has been marked by military coups and periods of authoritarian dictatorships. This is a problem for many countries in the region. Partly because of this, the citizens of these countries are very suspicious of centralized power. And as these countries have transitioned to become stable democratic countries, they have chosen to put most of the political power with provincial and municipal governments rather than with the central government. Simultaneously and relatedly, Argentina has gone through a series of economic boom and bust cycles, which has eventually led to substantial privatization of the transport sector and fragmentation of the health sector. For road safety, such decentralization creates a serious problem. The decentralization means that historically, the power to regulate most risk factors related to traffic crashes has been with provincial governments. This has made it very difficult to undertake coordinated national safety campaigns. This is an important point to understand. Decentralization of authority may be very good for promoting democracy, but for road safety, a strong centralized agency is important because it allows for the development of technical expertise and the ability to undertake large scale safety programs. So, now let's see what happened in Argentina. In the country, traffic injuries had been rising for decades, and through the 1990s and 2000s, there was substantial advocacy from NGOs about the importance of addressing road safety and from researchers and political entrepreneurs in identifying solutions. Through this process, an understanding had already emerged that decentralization was an issue to address. As a result, in 1995, the National Traffic Safety Act was passed, which focused on addressing decentralization by creating a common code of safety regulations. However, the act accomplished little over the next decade because the legislation provided no resources to actually address the very difficult process of coordination between the provinces. Now, a decade later, in 2006, the Santa Fe tragedy happened. 9 children were killed in a crash between a bus and a truck. The truck driver was drunk and unlicensed, and the school kids who died were on a school trip to distribute food and clothes to poor children. This was clearly an emotionally charged event. It received extensive media attention, with most news channels interrupting regular programming to describe the crash. The president, who had already been trying to help develop meaningful road safety legislation, heightened the drama by sending a military transport plane to bring back remains of the victims to the capital. The Education Ministry declared the day a National Day of Student Solidarity. That same year, the president instructed the National Safety Council to develop legislation for road safety. In the following year, the government and NGOs worked closely to do advocacy, declaring road safety as a human rights problem and initiating a signature campaign to get 400,000 signatures in support of the National Road Safety Bill. The following year, there was a new president elected. Luckily for the National Road Safety Bill, it was Nestor Kirchner's wife, Christina Kirchner, who took power, and she took the bill to Congress as one of her first initiatives, and the law was unanimously approved. The intense advocacy after the Santa Fe crash meant that political opposition to the proposed law would have been very difficult. Now, since Argentina is a federal country, the national law needed to be ratified by the provinces. Sustained pressure from advocacy groups helped to get most provinces on board. However, the province of Santa Fe resisted. The province argued that it was already doing plenty to address road safety and there wasn't reason to yield authority to the national agency. However, in 2010, tragedy struck again in Santa Fe when a crash killed 14 children. This event received intense media coverage again, which this time included safety advocates blaming the Santa Fe government for not ratifying the federal law. Following the negative publicity, the province quickly ratified the law. The bill created a national road safety agency and gave it jurisdiction to regulate safety nationally, and gave it a sustained funding stream, 1% of vehicle insurance fees. Notably, Rodriguez Laguens was appointed as the agency's first administrator. He had a reputation for being a negotiator and a consensus builder, which were important skills because the agency needed to get provinces to cede authority to the national agency. The government requested a loan from the World Bank to build the capacity of the agency to coordinate national road safety programs. Now, let us take a closer look at the World Bank loan request because it provides a window into understanding the goals of the new agency. The loan sought funds to address most aspects of road safety, such as awareness campaigns, enforcement, emergency response capacity, etc. All of this is not surprising. but I have highlighted in red the components that most clearly reveal the intentions of the agency. The largest component of the loan is a $10 million incentive fund, which provides grants to provinces. The purpose of the incentive fund was to position the National Road Safety Agency in a leadership role and to coax the provinces to cooperate. In fact, adherence to the national law was a precondition. Only provinces who complied with the national law would receive the funds. Similarly, the second largest component sought to build a common national registry for driver's licenses, traffic records, and traffic violations. This is interesting because it can be argued that such registries have no direct effect on road safety. However, the national agency's goal here was again to position itself as the leader for, coordinating nationally harmonized traffic regulatory processes. So now I'd like to conclude this presentation by drawing some general lessons from the case of Argentina. The first issue is the need to put institutions ahead of interventions. This issue receives very little attention. The academic literature and most policy debates focus on technocratic issues of which interventions work and which ones don't work. Of course, such discussions about effectiveness are important. However, these discussions ignore the fact that for doing interventions, especially large scale interventions, we need institutions that have the authority to conduct such interventions and the resources to do so. In a federal country with decentralized political powers, coordinating actions at the provincial level is a difficult challenge, and addressing these administrative issues is of paramount importance. The second issue is that such institutions are a result of political processes and not a result of technocratic debates. In Argentina, traffic deaths have been rising for decades, and political entrepreneurs have been looking for opportunities to address the problem. The Santa Fe tragedy, which left dead children from a crash with a drunk driver, provided that opportunity. The intense media attention created a focusing event that political entrepreneurs could take advantage of and push through a road safety bill that would pass without opposition and would be later successfully ratified. In this case, the focusing event was a major tragedy, but focusing events aren't always tragedies. Some of you may know that in the United States, the focusing event in the 1960s was a book called Unsafe at Any Speed, written by a young lawyer called Ralph Nader. The opening chapter of this book exposed a safety design problem in the Chevy Corvair. The book from an unknown author would likely have gone unnoticed, except it got revealed that General Motors had hired private detectives to follow Ralph Nader with the intention of blackmailing him. The public scandal created a focusing event that made it possible to push through strong legislation in the US Congress, which established the National Road Safety Agency. The third lesson is that the political process was entirely local. A tragedy happened in the country. Local NGOs and local policymakers leveraged the tragedy to push through a strong road safety bill and then engaged in intense political bargaining to get this bill ratified. The fourth lesson, while the role of international actors is small, they can nevertheless play an important role. In the case of Argentina, the World Bank was the primary international actor. Over many years, they engaged in the country, meeting with high-level policymakers to emphasize the need to address road safety and present examples of how high-income countries had addressed the problem. While the politics of change was primarily driven by local processes, the World Bank played an important role in advocacy for safety and framing the solutions. In conclusion, Argentina also provides an encouraging lesson for how road safety researchers and subject matter experts can engage efficiently in the policy process. In Argentina, professionals who cared deeply about improving safety worked for years to raise awareness, develop solutions, and disseminate good ideas to potential champions, while being cognizant of the political environment so that when the opportunity for road safety reform came to Argentina, they were ready to mobilize and work with political entrepreneurs to push through institutional reform. With the National Road Safety Agency established, the focus of road safety efforts now needs to shift to the technocratic aspects of attributing injuries to risk factors, identifying evidence based interventions, assessing their cost effectiveness, setting meaningful road safety targets, and rolling out interventions to achieve them. While establishing a well funded National Road Safety Agency is an important first step, the only real measure of success of these efforts is a reduction in the traffic injury and death toll in Argentina. Thank you for your time. I hope you have an excellent conference. Thank you.